Today's morning medicine, I'm going to do two medicines. I basically, you're live now. I basically was going to do just caffeine, but I realized there's not a lot of proving on it. And so I'm doing another one, which has some similar effects. Cainca Racemosa. Cainca Racemosa. Guess that's how you pronounce it. Chinacoca racemosa. It's a plant? Tincture of dried root bark. Okay, so caffeine. It's the alkaloid from coffee. And we do have a medicine that is coffea. Where is that? Coffea, LMN. Nope. Back. Coffea. I don't want to take too much time looking. Yeah, coffea cruda is what it is. And it's unroasted coffee beans. Okay, so caffeine, Coffea arabica, it says it's the alkaloid. So they uh, took the alkaloid out of I don't want to say they, anyways, they took the alkaloid out of the caffeine and they used that alkaloid, which I think it says the allopaths use it too. So dropsy, I'm just going to read this stuff. Dropsy depending on cardiac insufficiency. So when the heart's not working so well, you get what they call dropsy, which is fluid retention. And you've seen that in Trump with his ankles when they were swollen. That was cardiac insufficiency. And, basically they were saying that the valves were not, working well. And that's where myocardial degeneration, which is the valves, cardiac insufficiency in pneumonia, and especially when someone has a pneumonia and their heart's affected from it, which it can very well be. Uh, you would think of that. And other infectious diseases. Raises the blood pressure, increases pulse rate, which we know. If you drink coffee, you get excited, your pulse rate goes up, and it stimulates the heart muscle. So it actually has positive effects, when drinking coffee. And if you drink too much, it has negative effects. Hence, a support in extreme feebleness or threatened failure. And that's feebleness and failure of the basic heart and the vein stuff. Stimulates the respiratory center. So it opens up the lungs. Nerve centers, of course, makes you more alert, and increases diuresis, which is urinating. And diuresis is a 3. Do I have it up here? Stimulates respiratory nerve centers, increases diuresis. And I know you don't, this isn't the greatest way to do this. I could do this on Zoom and then put it into my Facebook page. It would look a lot prettier and all that stuff, but this is kind of authentic. I'm just writing this stuff out, and you may not see it as well as you should, but it's authentic. Let's put it that way. I'm not using AI. I'm not using all kinds of crap to do this. I'm basically just using the pen and paper almost. Increases diuresis, which is urination, neuralgias, any kind of nerve pains. It helps. Nocturnal exacerbation. So at night when the people can't sleep in that. And coffee is good for that. If someone's drinks too much coffee and they can't sleep at night, you take coffea cruda, and that helps. And same with caffeine. Acute pulmonary edema. So there's again, you're having fluid retention. Brachyalgia and other neuralgias. So that's the nerve pains. And brachyalgia is neck pain that goes down into the back of the shoulder blade and down the arm. And that also, that kind of brachyalgia also can um, mimic or be related to heart conditions, because I remember I always had a pain in my back between my shoulder blades, and like I always thought, oh man, it's just whatever it is, I don't know. And I'd had a guy trying to put the bone back in place, but it wasn't the bone. And he pushed so hard. He was a Thai, I forget what he called himself, like a chiropractor, and he was putting the bones back in place. And he pushed so hard, he broke, fractured a rib, not fractured it, but he injured my rib, and that was hurting. Even that took the pain away from my back. I'll tell you that. But yeah, that, and a buddy of mine, and why I say this is because of the heart stuff. A buddy of mine, that brachyalgia, which can be a neck pain, it goes down right down into the shoulder blade. If you look up brachyalgia, Brachialgia, something like that. The pain goes right down to the between the left side of the shoulder blade and down the arm. So, and that's from a neck, have a neck pain, pinched nerve up there or whatever. And there's a point right here that fixes that. Oh boy, is that sore. Oh, and I push on it. It's right above the collarbone. You push on that, and that goes right to that point, goes to the heart, and goes down the arm. But anyways, my buddy, we were at a funeral, and he said, "Yeah, I had this pain in my back where I usually have it by my shoulder blade." And he said, "Oh, I just must have pulled a nerve, a muscle, or whatever." And his girlfriend said, "Let's go to the hospital." And he went to the hospital, and here he had a slight heart attack, I think it was. And he since has passed, and probably same situation, didn't take it serious enough to change his diet and all these other things. And that's why, like I say, you can use homeopathic medicine to get your health back, your vitality back. But as a health coach, you basically want to change some habits in your life to keep your health. But anyways, so that whole heart thing with that pain and that brachyalgia can mimic the heart attack type of stuff. So because it goes right down the left arm and it goes right down into that point in your back. If you ever have that, you might want to get checked. A proving has been made with this alkaloid. So it's an alkaloid of the coffee bean, but has brought out, and it can be other from other substances like there's a cola. The cola nut has a lot of caffeine, a bunch of stuff that has brought out no symptoms not included in the pathogenesis of coffea. So the pathogenesis, which is the disease state of coffee, doing the caffeine thing didn't bring out anything different. Pulsation of the arteries in the head and temples was very marked. So you got a throbbing in there. Sparks before eyes, roaring in the ears, vomiting with relief of all symptoms. So when they vomit, they feel better. The citrate of caffeine, which is used in allopathic practice. So they're using this caffeine, they isolated the alkaloid, and they're using the citrate of it, has occasionally occasioned dangerous poisonous symptoms in a number of cases. So this isn't me saying it, but once again, using a substance to help things, and it can help stuff, they also can poison things. These seem the most characteristic. Restlessness, dizziness, unable to keep erect, unable to sit up, palpitations, violent precordial anxiety, heart stuff, abdominal pulsation, pulsation down in the abdomen, and the violent trembling of all limbs, grating of the teeth, features expressive of the greatest anxiety. So, a lot of anxiety when they took this medicine. Feeling of constriction of the neck and throat, recurring periodically every 15 minutes, pulse very rapid. So that all came from the allopaths giving the citrate of caffeine and overdosing a person on it. They were giving it for whatever symptoms. I don't know, heart stuff. I don't know what they were giving it for. They don't say. But they basically, when they poisoned the person, they had all that restlessness. And we know that from caffeine, restless, um, heart palpitations, grating of teeth, abdominal palpitations, violent trembling of the limbs, all that kind of stuff. So, anyways, that is caffeine. Aconite, chamomile, nux vomica, and cypress, I think it is all comparative. Caffeine and plants containing it, such as cacao, which I just did. I did cacao a little bit ago, I don't know, a couple videos ago. Cola nut and thea, etc. There's a lot of other ones. So, let's get into Cainca Racemosa, which is a plant. Where's the plant from? I don't know. Cainca is related botanically to China. China's another plant. Ipecac, another one, and coffea. So this one's related to all these, and that's why it's nice it's right here because it's related to coffee, related to Ipecac, which we use for people throwing up, and China. Clinically, it is very like apocyinum, which is another substance. Okay, so Cainca Racemosa, urinary symptoms, just like caffeine. Dropsies, which is fluid retention with dry skin. So the skin is very dry, but they're retaining fluid internally. Albuminuria, which is the protein from the blood seeping into the urine, with dyspnea, hard time breathing at night. They can't get their breath at night. They have albuminuria, which is the protein from the blood in the urine. Fatigue and weakness, worse in the evening. So they're everything's worse in the evening. Diarrhea and rest, worse evening, diarrhea, rest, and worse in the morning when they wake up. From motion, it's worse, and worse from 4 to 6 p.m., I think, or is that a.m.? They didn't really say, but 4 to 6. Anyways, I'd love to find out. I can look in some other books to see if it's AM or PM, but anyways. Feeling of anxiety in the mind with increased warmth in abdomen. So they get this anxiety, like they're just nervous and anxious, and they get this warmth in their abdomen while they're having that anxiety. Stitches in the spleen. This big spleen remedy is Cainca Racemosa. Fullness and inflation in the stomach. So they got this distension of the stomach, a lot of gas, a lot of rumbling, and a lot of cutting in the abdomen. So a lot of gas and distension and inflation of the abdomen. Back pain in kidneys. So not only the spleen has stitches, but the kidneys have pain, and that's of course, they're gonna the urinate and the polyuria. Oh, they don't have polyuria in this, do they? I think there's polyuria. Anyways, better lying bent backwards. So the kidney pain is better when they lie down and they bend it backwards. Takes the pressure off the kidney. Chest constriction and pressure in the chest, and that's probably why they have dyspnea. Uh, let's see, piercing, pricking in the right side with a weight in the chest. So they feel like there's a weight, and they get this piercing, pressing pain on the right side of the chest. But it's constriction and pressure and a weight and all that stuff in the chest. Uh, there is dyspnea. Is that this one, or was that? I should probably just do one at a time. It doesn't say dyspnea. Yeah, no dropsies, no dyspnea. Okay, we'll see when we get to the lungs. Intolerable, but anytime there's pressure and pain and weight and all that, you usually have a hard time catching your breath. Intolerable hissing. This is bugging me. Dyspnea. Yeah, there's dyspnea. I thought so. I got these two medicines sort of mixed up in my mind. Intolerable hissing in the ears. So they got this sound, a roaring, a buzzing like insects in the ears. So that's that, what do they call that? Tympanic? No. I forget what they call that when you have that. They call it a certain disease when you have all that noise in the ears. Eyes burning with edema. That's fluid retention, but they have burning in the eyes, pressure with troubled vision, and photophobia. They can't handle light, but they have their vision's is off. Face has heat, so heat in the face. Female, nothing. Food, evening, appetite is good. But anyways, appetite or less during dinner, and no appetite during dinner. So when it comes to dinner time, no appetite, but in the evening, their appetite gets better. And they have thirst. Headache or heaviness in the front of the head, and pressure and uneasiness in the front of the head. So in the front of the head, they have that uneasiness, that pressure, and that heaviness. Violent headache. So this headache is so violent for them. Feeling of a weight and pressure on the occiput, that's the back of the head. And it says the syncope, which is the front, which is the very front of the head. So you have the occiput in the back, and the syncope is the front to the vertex, to the top of the head. So from the forehead to the top of the head, they have this heaviness, violent pressure and uneasiness, and they have some pressure and weight in the back. Let's see, is this can't read or think from, yeah, this is okay, this is why can't read or think from it. That's got to be with the headache. desire to urinate, polyuria while traveling, burning in urethra. So this headache they can't think or read. That's part of that. Sorry. Constant desire to urinate. And you can tell this is real. This is not AI generated. This is not none of that. I just basically put this all together by hand, and it can be messy. Constant desire to urinate, polyuria, which is same thing, a lot of urination while traveling. So they're always, I don't know if it's from the jarring, but it's definitely kidney stuff. But the jarring probably causes them to always have to, have a lot of urination going on while traveling. And there's a constant desire. So that's that kidney pain in kidney. So, there's definitely kidney stuff going on here. Pricking pain in left hand. So there's this like a something stabbing in the left hand, like a pricking pain. Heaviness in lower limbs. Lassitude in soles. Lassitude means the feeling of weakness in the soles, and that's a weird sensation. Who would think you have a weakness in your soles? I can see a weakness in the legs, but lassitude in the soles, which is a weakness, and a pricking pain also in the nail of the great toe. It doesn't say right or left, but it's a pricking pain in the left hand and a pricking pain in the great toe. Why would this be of importance? If you're looking at some medicines and you have a couple of them, I don't know which other ones go with Cainca Racemosa, but if you're looking up symptoms and you have someone that has this, my left hand has a pricking pain, or they have a pricking pain in the great toe, the nail of the great toe, this would help you to differentiate between them. And lassitude in the soles, I don't know if you'd have another medicine that has that. Let's see. So lungs, tickling cough with tough green. Oh, I did mess this up because I missed lungs. Then I did something, I think, oh, I missed lungs and I was doing Mayo and all that, and I had to come back and do lungs. So, lungs, tickling, this is all male, and I had to put lungs in over here. Tickling cough with tough greenish gray mucus. Wakes him at 3 a.m. So I don't doubt this 4 to 6 is in the morning for the worse, or yeah, worse in the morning, 4 to 6 a.m. And their mucus, this tickling cough and this tough greenish gray mucus wakes them at 3 a.m. So that's all the lung stuff. Now, Mayo has a lot. Drawing in the testicles and sperm cord. So there's a drawing sensation, like almost like a pain, but it's more of a drawing. Pain worse during passage of pungent urine. So the urine's very pungent. And there's pain during that. It doesn't say burning or anything, but there's pain during that pungent urine. Horridly excited sex impulses, lascivious dreams with erections. So at night, this is probably bothering them. And they awaken by emission. So they have a wet dream, basically. So they're having all these sex dreams, all these erections, and all this emission at night. And the testicles and the sperm cord feel drawn up, and the pain when they urinate, and it's very pungent, the urine. Offensive breath, salivation, taste perverted. Oh, with this offensive breath, my cats, I've been dealing with them, and I've given them Allium Cepa that stops some of the stuff, but they still have this stuffy nose and that. So I was going for like I don't know, but I just realized, and I smelled their nose, the mucus and that in their nose. They got a sinus infection. I got cats with a sinus infection. So what I looked it up, and I got Calibic and Pulsatilla. So on the one, I tried Pulsatilla so far. So we're going to see. So, I mean, this is the way you got to do it. I can't get any symptoms from a cat. So I basically have to decide what's going on. So I have to observe. So they've got a lot of mucus, and when they breathe, you can hear them breathing, through their nose. That's why the cat was breathing through his mouth, because the nose was so stuffed up. And before it got stuffed up, it was running like crazy. My wife said the snots were hanging way down out of its nose. So I gave it Allium Cepa, which is basically you cut an onion, your nose runs, and your eyes water. Now, probably another medicine. So then I gave it aconite, and that seemed to help. But now I'm realizing, it's they're sneezing, number one. still have a, they'll breathe, try to breathe through their nose when they sleep, and they blow, they're blowing bubbles, so they got a lot of mucus, and it's clear. I'm not, you can't get them to blow their nose to see what kind of mucus they got. When they sneeze, there's nothing really coming out. And so I basically, I was wiping the cat's nose, and I smelled, and it smelled like, smells like infection. So now I'm shooting for infection. I gave pulsatilla. Calibic was another one. There's Heprosulf, a few others, but the Calibic and the pulsatilla. So I gave the one pulsatilla, and they all went outside still, even though it's cold. And I want to see, seemed like she was doing better outside. So pulsatilla they went out in the fresh air. So we'll see. So I'm still dealing with that. But that offensive breath, I just reminded me of the offensive smell coming out of the nose and out of the cats. Salivation. That sounds like mercury. And mercury was another one with that, it has offensive breath and salivation. So mercury was another one in there with the mucus, the violent thin mucus, it says, excoriating nose, especially daytime. So mercury's another one with all this offensive breath and a lot of salivation. Taste is perverted. It's bitter and burning is the taste. They when they eat that, it just doesn't taste right. Tearing in the teeth of the upper jaw at night. I thought it was the lower jaw. Anyways, tearing in the teeth in the upper jaw at night. Let's see what it says here. What am I on? Nose, mouth. Okay, so mouth. Drug taste and salivation, longer taste, perverted taste in the whole mouth. Okay, here we go. Yeah, upper jaw. Okay, I thought it said lower jaw. Okay, so anyways, tearing in the teeth in the upper jaw at night. So when they're, a lot of night stuff going on, and you'll see they won't sleep well. Violent catarrh from the nose of thin mucus, and that's what's going on with the cats. I probably don't have this medicine. Excoriating nose. Now, when you say excoriating, that's like burning that, and you get the same thing with allium cepa. It kind of burns the nose, it burns the lips, and stuff like that. So allium cepa could be considered here, especially in the daytime. So all this violent thin mucus excoriating the nose is in the daytime, especially. Can be it can be at night, but it's especially at the daytime. Frequently calls for stool, the rectum. They always want to go and have uh, take a crap, basically, but nothing but air comes out. So that's where that abdomen, a lot of flatulence and rumbling. They got a lot of air. There's a fullness and inflation of the abdomen, and they have a burning in the anus and a tickling in the anus. Frequently scratches the anus, so they're always picking their butt. Anyways, there's nothing deeper you can say about that. They have a burning and a tickling. There's no hemorrhoids or nothing, but burning and a tickling, and they're always desiring to go to stool, but nothing but air comes out. So there's obviously a constipation. Doesn't say no diarrhea with this one. Some of them alternate with diarrhea and constipation. This one must be just a constipation with a lot of air, a lot of rumbling. They call borigami when your stomach rumbles and is full of air. But they have this burning in their anus and a tickling in the anus, which causes them to frequently be scratching their anus. Man goes to bed with itchy bum, wakes up with stinky thumb. I don't, sorry. How much time do I have left? I got plenty of time. Yawning and stretching of limbs. So they're always yawning, and they're stretching out the limbs. Uh, Probably makes it feel better. The limbs. What is there on limbs? Prickling pain, heaviness of lower limbs. So they're basically stretching out. I guess that heaviness causes them the need to stretch. So you see someone sleeping and they're sitting there yawning a lot. They're not sleeping yet, but they're stretching their limbs. Sleeplessness and restlessness. Now there's a lot too to sleep. Let's see what else. Couldn't write it all down. I don't know what the heck that was. Sleep, yawning and stretching of limbs, sleepiness in the morning, sleepiness in the morning because they didn't sleep well. Somnolence, which is insomnia, I'm pretty sure. Wait a minute. Let me look it up. Sleepless during the whole night, sleep very restless with lascivious dreams, yielded to desire to sleep. Okay, so where's my dang phone? Somnolence. Let's look it up and see. They always got these big terms that really you don't need. Somnolence.
Somnolence is the medical term for sleepiness or drowsiness. It's a feeling of tiredness, and it can be normal, like before bed. However,
Okay, so somnolence is probably a daytime thing. That's why they have that somnolence. Uh, so they have a lot of sleepiness, most likely during the day, and sleeplessness during the night. They're restless. They have these dreams. It doesn't say the female has those dreams, but mainly the male. They're stretching out their limbs. They're yawning, but they're not getting the rest they need. So when they wake, they have this sleepiness during the day. Belching, nausea, and vomiting in the stomach. So that's all that gas, obviously here they have digestive problems. Basically the food's going in, it's not being digested, it's fermenting, and yeah, it's giving them all this gas and all this problem. Let's see, stomach, small doses of belchings, like small doses, they would give tartar of emetic, which is for that, I guess, that belching and gas. Anyways, dryness of throat, trembling of hands, this is all in the stomach. Nausea and vomiting. So you can see there's a concomitant. The dryness of the throat is and the stomach stuff is related to that trembling of the hands. Nausea and vomiting, much tasteless belching. So it's not heartburn, it's just a lot of belching. So they're obviously not digesting their food well. Vomiting and slight shivering for half an hour. So, yeah, it's weird. Violent vomiting from 3 spoonfuls. Oh, so they take 3 spoonfuls of food and they vomit violently. Much wind came off the stomach. Feeling of cold in the epigastric region. Okay, so let's do temperature. Heightened temperature of the body. Sweat with moist skin. The skin's very moist, a lot of sweating, and the temperature's high. Sweat in evening with shivering. So there's a lot of sweat with shivering. There's a lot more warmth all over the body, sweat, moist skin, sweating even when at rest. So in other words, they're not active and sweating from being active. He perspired more easily than usual with him in the evening. He perspired all over. Okay, so now throat. I think there's more on the throat. Hoarseness, ulcers. So they have a hoarseness with the throat. They have ulcers in the throat. Two, they hawk. Oh, two eustachian tubes with itchiness. So they've got these ulcers and they've got this throat. What is it? Ulcers in throat, two eustachian tube. There's got to be some kind of pain. Let's see, the throat. Ulcers to throat and eustachian to distressing dryness of throat. Okay, obliged. Okay, let's so they got so a lot of times when you have throat problems, it will go up into the ear, and that's in colds, flus, anything like that. So they have a distressing dryness, very dry throat. Okay, let's get into, there's more throat stuff. Obliged to hawk from often from irritation of throat, so they're always hawking up mucus. Burning and grating pain in throat, rawness of throat with taste like that of pepper in it. So pepper, you know what pepper feels like. It's like a burning almost in the throat, but it's raw, very raw and dry, and they're hawking up all this mucus, and it's very irritating. Scraping in throat forces him to cough. So that's what brings on the cough. It's coming from the scraping and the burning and the stuff in the throat. Burning and pharynx, same area, basically the throat. At first, with sensation as it from pepper. So they always feel like there's pepper irritating the throat. Dry, burning heat in pharynx, feeling of itchiness and scraping. Dysphagia, what is that again? Cold feeling down the esophagus. Let's see what this dang word is. Where is that? Dang it. Asphagia.
aphasia is a
No,
language
that's the
disorder
wrong
that
one.
impacts speaking, understanding,
Oh,
reading,
that
and
ain't right.
writing,
That ain't right.
caused by brain damage, often from stroke.
Dysphagia.
Symptoms can include trouble finding words or
Dysphagia.
understanding speech.
There it is.
Dysphagia means having difficulty swallowing,
Okay,
which can
so
range
that's
from
just
feeling food
difficulty
stuck.
swallowing. Okay, so asphasia, they can't swallow, which makes sense. They got a burning, they got, it feels like peppered or coughing, dryness, rawness, all that stuff, hocking up mucus. Hocking just means you pull that mucus out of your throat. Let's see. Oh, I didn't put tongue in there, did I? Dag nabbit. Sometimes I do these on the board and I've got 800 things going on. I missed some stuff. Cold feeling down the esophagus. So not only is this burning and this heat in that, but the esophagus feels like a cold feeling. Okay. Tongue is coated with mucus. Tongue, and that makes sense with them hawking up all that mucus. Tongue exceedingly dry with a white and very dark coating. Tongue furred white. So there's that whiteness on the tongue. And the tongue's very tells you a lot about what's going on. That white tongue is all that stomach stuff. If it's a yellow tongue, yellow stuff on the tongue, that would be liver and kidney stuff, or kidney stuff. I think liver would be dark tongue. Anyway, symptoms, okay, vertigos, giddiness with vomiting, especially going upstairs or up a hill or up an incline. Um, but they got giddiness with vomiting. So when they're vomiting, they're laughing. So this medicine is compared to apocyinum, arsenicum, and bryonia, similar to coffea in relieving effects of fatigue. Also arnica. It's antidoted by colchicum, rus tox, and gastralgia. So when they have gastralgia, this stomach stuff, rus tox would be one. Veracium, Cainca follows well. So after you use veracium for whatever sickness, disease thing you got going on, Cainca Racemosa follows well. And arsenicum's another one. And arsenicum has a lot of burning and things like that. So, anyways, you know, that's the whole idea with homeopathic medicine is you're look. Oh, I'm over. Sorry. You're looking up symptoms and you're trying to find things, and then you have to differentiate between different medicines to make sure which one. That's what I'm doing with the cats. I'm differentiating between allium cepa and arsenicum was the two, aconite. There's a few medicines this can be, mercury, hydrastis, all these medicines could be for the cats, and I have to figure out by observing what's going on, the smell, the stuffy nose with the mucus bubbles blowing out, things like that. I have to determine which medicine would be best for this. Once I hit it, I'll give it to all the cats. I think there's one, two, three of them seem to have this. One and two of them seem okay. I got six of them. Anyways, I would, once I determine which medicine's good, it should be good for all of them. Some of them we're all individuals, so some may need a different medicine, but once I get the one medicine to clear up that sinus infection they have, which is I know that's what they have because of that smell coming out of their nose. So once I figure it out, then I can give it to them all. So in their water, I'll put it in a bowl of water that they drink from, stir it up about 100 times, then they drink it, and they'll get doses every time they drink out of that water. So, all right, that's morning medicine. You can age, but you don't have to get old. Tomorrow is Kaju Pudum oil, whatever that is, another root.